Our today's discussion is about herpes simplex, herpes zoster, and varicella zoster. The first one is the herpes simplex. The clinical depiction is as follows on the skin and on the lips. Herpes simplex. It is a common viral infection caused by herpes simplex virus (HSV) that presents with localized blistering. Herpes simplex is commonly referred to as cold sores or fever blisters, as recurrences are often triggered by the febrile illness such as a cold. What causes herpes simplex? Herpes simplex virus are categorized in two types: HSV1 or oral herpes and HSV2 or genital herpes. Herpes simplex type 1 is transmitted through oral secretions or sores on the skin, and it can be spread through kissing. Herpes simplex type 2 can only be transmitted during sexual contact with someone who has genital HSV2 infection. Clinical features: primary herpes simplex. Primary infection with herpes simplex virus can be mild or subclinical, but symptomatic infection tends to be more severe than recurrences. Type 2 HSV is more often symptomatic than type 1 HSV. Symptoms include fever, restlessness, foul breath, painful eating and drinking, and swollen gums. Recurrent herpes simplex. After the initial infection, whether symptomatic or not, there may be no further clinical manifestations throughout life. Where viral immunity is insufficient, recurrent infections are common, particularly with type 2 genital herpes. Recurrences can be triggered by minor trauma, surgery, or procedures to the affected area. Upper respiratory tract infections, sun exposure, hormonal factors in women flares are not uncommon prior to menstruation, and emotional stress. Then the difference between cold sore, herpes simplex, and pimple. So the cold sores develop around lips, nose and nostrils, chin and eyes, while pimple can develop over entire face including border of the lip. The cold sore forms cluster of blister, while pimple form a red bump, not a blister. Cold sore crust over several days, and pimple never occurs directly on the lip itself. Cold sore are contagious, pimple are not contagious. The treatment of herpes simplex include Aclova. The generic is acyclovir. It is an antiviral drug. The dose is by mouth for children 12 to 17 years. 400 mg twice daily, alternatively 200 mg 4 times a day, increased to 400 mg 3 times a day. Dose may be increased if recurrences occur on standard suppressive therapy. And in adult, 400 mg twice daily, alternatively 200 mg 4 times a day, increased to 400 mg 3 times a day. Dose may be increased if recurrences occur on standard suppressive therapy. Then Varicella zoster. It is also called as chickenpox. Chickenpox is very contagious infection caused by the Varicella zoster virus. It mainly affects kids, but adults can get it too. Symptoms include rash that turns into itchy fluid-filled blisters, fever, tiredness, loss of appetite, and headache. Then herpes zoster. It is also called as shingles. Shingles causes a painful rash that may appear as a stripe of blisters on the trunk of the body. Herpes zoster. It is also known as shingles. Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it most often appears as a single stripe of blister that wraps around either the left or the right side of your torso. Shingles is caused by the Varicella zoster virus, the same virus that causes chickenpox. The treatment for both Varicella zoster and herpes zoster is again antiviral drug acyclovir, which is taken by mouth. In child 1 to 23 months, 200 mg 4 times a day for 5 days. In child 2 to 5 years, 400 mg 4 times a day for 5 days. Child 6 to 11 years, 800 mg 4 times a day for 5 days. Child 12 to 17 years, 800 mg 5 times a day for 7 days. And adult 800 mg 5 times a day for 7 days. By intravenous infusion, Adult dose is 5 mg per kg every 8 hours, usually for 5 days. So this is all about the herpes zoster, herpes simplex and varicella zoster.